Hi, friends. My name is Rita Tech, and I am chairman of Aurora's Key Community Response Team. And coming to you today to just remind you of a few things that are going on in the community. Our mission at the KCRT is to be a bridge, a liaison, especially in communicating things from the city to the community and from the community to the city. And we want to continue doing that even during these difficult times. These are hard times that we're in, a lot filled with uncertainty and challenges. And we know that we need each other and that we need to keep on doing our jobs. Some of you are doing some really crucial, essential jobs for the community, and we need to be at our best even during these difficult times. Probably working differently, but still at our best. It's during these times we're being told all the things we can't do. Can't go to school, can't go to restaurants, can't get a haircut, can't go to church, all kinds of things we can't do. But remind you that there's still a lot of things that we can do and should be doing. We can continue to be working. Again, you're doing some important jobs for the community, for your family, and for your neighbors. You need to keep doing that and do that to the best of your ability. We also need to make sure that we are communicating. I think during these kinds of moments, communication is really, really important. It's important that we communicate with family members, with community people, with our clients, with colleagues, other people that are involved. They may need our encouragement or our support, or we may need their encouragement and support, but it's important to communicate. So I'd encourage you to pull out your phones and make a few phone calls to people that you know that may need some encouragement or that you just may need to talk to, maybe people that you've wanted to talk to for a long time. This might be a good moment to do that. I'm sort of reminded of that great prayer, the Serenity Prayer, that is sort of made famous by Alcoholics Anonymous, but been around for many, many years and applies to us all. It says, God, grant me the serenity to accept the things I cannot change, the courage to change the things that I can, and wisdom to know the difference. My hope would be that during this difficult time, that we would do the things that we can do and not quite focus so much on the things that we can't do. And so listen carefully to what the rest of our speakers have to say today. And it's our hope and our prayer that we'll be back together again soon. But in the meantime, we're going to keep on doing what we do, because it's in moments like this that we are at our best and that people need us the most. See you soon.
Over my brief time so far as mayor of Aurora, one of the things I've looked forward to the most is the monthly meetings of the Aurora Key Community Response Team and the opportunity to hear from and get to know leaders from across our great city. AKCRT is such a fundamental and important part of the fabric of our community, encouraging engagement, awareness, and conversation between the city, our public safety professionals, and members of the public. It is difficult to not have those in-person conversations during this COVID-19 pandemic. But I'm grateful for opportunities like this to stay in touch and hope you'll continue to reach out to me when you have questions or concerns. Now more than ever, it's essential that we forge connections with each other, reach out a helping hand to those in need, and ensure that no one is forgotten or overlooked. As we begin to move out of the stay-at-home order and into the safer-at-home phase of this crisis, I hope you'll join me in encouraging our neighbors to continue practicing social distancing, wearing face coverings when going out, and supporting local businesses if you can. Set the example for those around you and remind each other how the good practices we've established over the past couple of months still help to protect our most vulnerable community members and continue to flatten the curve of this deadly disease. We still have a long ways to go, but we can get through this together, Aurora. Thank you, and I can't wait to see you all again in person as soon as it's safe and advisable.
Hello everyone. I wanted to provide you all with a quick update on how our department is doing. At the beginning of April, and with the help of city management, I was able to procure 2,000 rapid response COVID tests from a local company that we shared with the police and fire departments. We are now able to test our employees and receive the results rather quickly. These results will determine if additional testing needs to be completed or if the employee can return to work. We also continue to provide our officers with personal protective equipment for them to use during their shifts. Our primary focus continues to be patrol and being able to respond to calls for service. Currently, we do have a modified call response to some types of calls. But depending on the incident, we may ask you to complete an online report or report over the phone. This is done to not only protect you, but our officers as well. Some of our special assignments, like our PAR unit, school resource officers, and some of our traffic units have been temporarily reallocated back to patrol. We want to ensure that we have adequate staffing for our patrol teams so we continue responding to calls while also limiting the number of officers potentially being exposed. Unfortunately, we have seen an increase in domestic violence calls. We want to remind everyone that we have a dedicated victim advocates unit available 24 hours a day, 7 days a week, and please do not be afraid to call us. Resources are still available to anyone who needs them by calling our dispatch center. You can even use your cell phone and send a text message to 911. Our dispatch center can now receive those text messages and respond back. Please do not be afraid to report domestic violence cases or cases of child abuse, whether it involves you or someone you know. This call may save your life or someone else's. We are continuing our outreach to our diverse community to reassure them and to address any concerns they might have. We want to remind everyone that we are out there every day serving you, and we are only a phone call or text message away. Lastly, I want to say thank you to our Public Safety Communications Division, the professional staff, and all the officers who are out there working during this difficult time. Your dedication to our community does not go unnoticed. Thank you all for your support.
Hello, I'm Fire Chief Fernando Gray. I want to extend my greetings on behalf of the men and women of Aurora Fire Rescue. I first want to acknowledge and thank Aurora's Key Community Response Team for the many years of service and support that you've shown the residents of Aurora and to the public safety agencies who serve this community. I don't want to move into our update until I offer my condolences following the passing of our beloved community member and AKCRT participant, Reverend Milton Thomas. Reverend Thomas will be remembered for all of the goodness he provided and shared with others in our community. His work inspires all of us to learn the joy and honor of giving back. We also grieve alongside Dr. Barbara Shannon Bannister, as she recently lost her husband. We offer our prayers to all those who mourn the passing of Mr. Gordy Bannister Sr. and recognize the lasting impact he had on not only our community, but this entire region. As you are aware, Aurora Fire Rescue provides fire and EMS services in our city. In fact, about 70% of the work we do involves providing emergency medical care. Call volume has been steady for our firefighters and paramedics. An additional complexity due to the COVID-19 incursion is the need to enhance decontamination procedures for our apparatus and facilities, constantly acquire personal protective equipment for our members, and remain current with best practice medical protocols. While this is a busy time for us, we want to reassure you that we're a department of men and women who provide compassionate care and who are constantly learning and improving. Our members have been called to medical emergencies at homes, apartments, assisted living facilities, and shelters. Each patient is treated with expert medical care, compassion, and dignity in all circumstances. Prior to the incursion of COVID-19 into our city, the Aurora Fire Rescue Community Health Officer was visiting assisted living facilities and communicating with senior residents who were likely to be most impacted by the virus. Literature was distributed and the potential impacts were discussed as a proactive approach to serve this vulnerable population. Currently, we respond to approximately 100 incidents per day. Even with this frequency, we have been able to maintain our supply of personal protective equipment for all of our members through planning and proactive ordering. This equipment includes eye protection, gloves, masks, and full isolation suits. In addition to that equipment, we utilize a clinical approach to keeping a safe workforce to include twice daily health assessments, temperature checks, and COVID-19 testing when necessary. By keeping our men and women healthy, we have been able to maintain full staffing for every station in our system, delivering the professional and fast response our residents expect from Aurora Fire Rescue. Moving forward, we will continue to monitor data coming from the CDC, CDPHE, and from our partners at Tri-County Health. We receive frequent briefings from our Office of Emergency Management, who is handling regional coordination between hospitals, counties, and other stakeholders. I am so proud of those who wear the uniform. They have shown their courage and expertise during this difficult time and haven't wavered in their commitment to service. Be safe and stay healthy.
Hi, everyone. For everyone that I haven't met yet, my name is Matt Chapman. I'm a battalion chief with Aurora Fire, and I am also responsible for the city's emergency management. Wanted to give you a quick update on some of the activity that we've been experiencing and some of the things that we've been doing over the last couple of months in response. Our main job is obviously coordination, citywide coordination, large-scale emergencies. And this has been a challenging couple months, kind of unprecedented territory for emergency management and everyone involved with response in general. Quick couple things. We stay in close coordination with all of our partners involved in this, naturally public safety and Tri-County Health. The Tri-County Health, for those of you that don't know, is our public health authority for the City of Aurora. They have provided a lot of guidance for us and direction throughout this incident. Our hospital systems, we stay in close coordination with our hospitals on a daily basis, really monitoring medical surge and the capacity in the hospitals. So one of our objectives for this was to reduce that medical surge and build capacity in these hospitals as well. So if there needed to be more space added, that we were ready for that and we were planning for that. So those plans are still ongoing. Right now, things have leveled off, and that's a good sign, but those plans are still in place, what we may need to respond to in the following weeks. We're also heavily involved in personal protective equipment distribution. So our logistics section has been active daily in getting some of these supplies either on our own from private vendors or from the federal government or from the state government in their cache and their stockpile of equipment. That has come to us. We're helping as much as we can distribute that. We're taking requests from long-term healthcare facilities, home health facilities, and those kind of facilities. So we are distributing that as best we can. We're getting that out to folks to help them with their response to this as well. Naturally, that's also going to first responders and also some of our own city staff as they are essential in working through this. We're looking close at economic recovery. So in so many of these, there is the need to still be in response and be dealing with recovery items at the same time and making sure that gets structured correctly. So the city has put together a recovery committee, and we are working closely with them as we still deal with response issues so that we stay in a coordinated step with them and consistent step with them. We're also looking at staying closely connected, and we have been throughout this event, with our surrounding jurisdictions and cities. So our counties, our cities, their offices of emergency management, we're in daily contact with in order that we have a coordinated effort, a consolidated coordinated effort with our surrounding emergency management offices. See, we are still under disaster declaration as of Friday. This is May 1st, and that has been extended twice, I believe, so that we are still eligible for some of these benefits and are eligible under the actions that we're taking for potential federal reimbursement, and just frees us up with the ability to do more things with the disaster declaration in place to take care of immediate needs and immediate emergencies that's resulted from the COVID-19 issue here. We continue to update daily. So this changes quickly and changes rapidly and changes on a daily basis of the guidance and what we know and some of the public health numbers. And we continue to put out our situational awareness report each day. That comes from Patricia Mason, and I want to thank them as well. The rest of the emergency management team, Patricia Mason, Brandon Lindrink, and Sergeant Kerrigan Bennett, our APD liaison to the office. They have put in a lot of hours over the last 2 months and have worked pretty tirelessly to set this framework in place for the city and get us on the right path as far as response and then as we roll into recovery. I think those are the highlights from us over the last 2 months. We, as always, if you have any questions for us and what we're doing as far as response and working into the recovery, please don't hesitate to reach out to me if I can do anything for you. And I hope to see you all again soon.
Hi, this is Michael Bryant with the City of Aurora's Communications Department. First, I want to say thank you to all the members of the Aurora Key Community Response Team for your ongoing work during the COVID-19 crisis to keep members of the community connected and to keep them informed and aware of what available resources there are for them when they may be in need during this time. We know that the residents and our businesses in Aurora have many questions right now and face some confusion sometimes based on the rules that may differ over time and also be different based on your location. We have many resources as a city to keep people informed of issues that affect you as Aurorans, whether that be how to stay connected with your government leaders, how to participate in city council meetings and other government meetings, how to know which facilities are open or closed, and what events might be changed or affected by the crisis, and also how to access important information and resources from the city online. The best and most complete resource for you is going to be the city's website, auroragov.org. There you'll find a host of different available online services that are available to you regardless of whether a specific facility is open to the public or not. On our website, there's also information specifically related to COVID-19, including community and business resources. You can access those pages from anywhere on our website by just looking for the red banner across the top of every single page. That will connect you with that. Or you can go directly to auroragov.org/COVID-19. Also on our website, there is special programming that is available from our libraries, from our Aurora History Museum, recreation centers, Aurora Fox Arts Center, Aurora Dance Arts, Art in Public Places, and the People's Building. All great ways to keep you engaged and active while you may be stuck at home. Another way to stay up to date on what's happening is just subscribing to the city's weekly email newsletter called This is Aurora. You can do that just by going to auroragov.org/newsletters, where you'll find a list of all the city newsletters and easy ways to sign up. Another great way to stay up to date is just to follow the City of Aurora on our various social media channels. We are constantly posting important information, updates, and information on Facebook, Twitter, Instagram, and Nextdoor. Connect with us at AuroraGov or at individual city departments' own social media pages. As always, if you have any questions, concerns, or needs, please contact Access Aurora at 303-739-7000. Thank you, stay safe, and stay connected.
Hi everybody, it's Claudine McDonald with the Community Relations Division with the City of Aurora. Here sitting in my home office with my dog Quincy sitting by my side. He's my new office mate. But it's a little different sitting here doing my updates with the Aurora Key Community Response Team versus standing in front of our large group typically. But things are a little bit different now, so hopefully you could grab a pen and paper and we could give you some updates. So first thing, I want to talk to you about a local food assistance program that we did a couple weeks ago, actually now it's been, where we partnered with KE Distributors. They're a local food distribution company that works in Aurora. They brought in 20 pallets of food worth over $30,000, healthy food that was brought in. We partnered with Heritage Christian Center. These 20 pallets then got distributed to local community organizations. They included Salvation Army, Dayton Street Opportunity Center, Restoration Outreach, Aurora Interfaith Community Services, and the One Place Project. That food then got distributed into the homes of our Aurora residents. Just want to thank KE Distributors for, again, stepping up to the plate and helping our Aurora families. Speaking of One Place Project, they continue to meet the needs of our community with some of our most vulnerable populations. They're providing food, baby items, and community resources to victims of crime and domestic violence with bi-monthly drive-through events at Aurora Central Library. The One Place Project has been able to serve 225 households in the last 3 months. This represents over 600 children. They are still in need, so if you would please reach out to our department, our division, and see how you could help. Our information will be up on the screen. Also, the second annual Aurora Youth Expo, you've heard me talk about it over and over again. Unfortunately, that was scheduled for June 6th. We're going to have to cancel it for this year. We are concerned about our community and large gatherings, so out of an abundance of caution for our community, we are going to have to cancel that event. Please reach out to me. We are looking for ways to empower our youth and prevent youth violence over the summer. We have some ideas in mind and we're already working on those initiatives right now. So again, please reach out to me if you have some other ideas and you'd like to partner with our division. Also, the LGBTQ plus summit that we had planned for July, we're also putting that on hold. That was going to be an inaugural event for us, and we wanted to make sure that we did it right. So we're putting that on hold. But if you would like to be a part of that planning, please again reach out to us. Exciting news that we've partnered with the Aurora Interfaith Community Services Program to begin to implement a mobile food pantry distribution program. We've met with Christina Simpson and we'll be utilizing their infrastructure for food and volunteers to drive and deliver food baskets to some of our vulnerable families. It's time like this that we have to kind of think outside the box and we can't do things like we've always done before. So I'm excited that the Community Relations Division was able to support this initiative and get it off the ground. Again, this is Claudine McDonald with the Community Relations Division with the City of Aurora. Unfortunately, I can't see you right now, but one day soon. Take care and I hope you're all well.